Okay, good day to everyone. I am Agostini Marilaga and I will be reporting about the importance of chemical examination of urine. So, the topic that was assigned to me is only about the importance since the chemical examination of urine was already reported by my fellow classmates. So, we will also go through some good to know things about this type of urine examination as we go along with the report. So, before I am going to begin with my topic proper, let me first give a very brief recap on the examination of urine, also known as the urinalysis, para mas ma-visualize nato ang different types of examination of urine for us also to further identify the importance of chemical examination of urine. So, urinalysis. So, what is urinalysis? So, it is an ordered panel of tests from a urine sample which can aid in the medical diagnosis. So, this is used to detect and manage a wide range of disorders. So, the examination of urine or the urinalysis can be divided into three distinct categories, namely the physical examination of urine, the chemical examination of urine, and the microscopic examination of urine. So, unsa man ni sila? The physical examination of urine or the gross inspection or observation of the color, transparency, specific gravity, odor. So, the second one is the chemical examination of urine, so also known as a dipstick, since it makes use of um, test pads which have chemicals in them and is dipped in the urine to acquire and note the color reaction. And the third category or type of urine examination is the microscopic examination of urine. So it quantifies the WBCs, RBCs, and it assesses for the presence of bacteria, crystals, casts, and other urine sediment constituents. So, kani sila, mo ni sila ang mga urine sediment constituents. So, now that we know that there are two other categories of the examination of urine, do we still need to chemically examine the urine? So, isn't the gross inspection and quantifying the cells enough in aiding or enough to aid in the diagnosis? So, why is chemical examination important anyway? So, I have listed three major, um, three main reasons or three importance of chemical examination of urine. So, let's begin with the first one. So, chemical examination is important because it tests chemically for about 10 substances which provide valuable information about health and disease and determines the concentration of the urine. So the about the 10 substances, it was already reported previously and explained specifically, so we just need to have a one run through or a very brief description for each. So the 10 substances are as follows. The first one is the pH. So the pH of urine may change with diet, medications, kidney disease, metabolic diseases such as diabetes mellitus. So any condition that produces acids or bases in the body or the ingestion of acids or bases will directly affect the urine pH. So a pH below 7 indicates an acid urine, and the pH above 7 indicates an alkaline urine. So the next one is the protein. So normally, the protein, specifically the albumin in urine, is undetectable. So when urine protein is high, you have a condition called proteinuria. So this can be an early sign of kidney disease. The next one is the glucose. Glucose is normally not present in urine, so when glucose is present, the condition is called glycosuria. The next one is the test for ketones. So the ketones are intermediate products of fat metabolism. So this happens when a person does not eat enough carbohydrates or when a person eats enough carbohydrates but the body can't use them properly. So the ketones in urine give an early indication of insufficient insulin in a person who has diabetes. So the next test is the test for blood. So this test is used to detect the presence of blood in the urine, which may indicate infection or trauma of the urinary tract or bleeding in the kidneys. Okay, so the next test is for the bilirubin. So the presence of bilirubin in urine is an early indicator of liver disease and can occur before any clinical symptoms. So the next one is the urobilinogen. So this test helps identify the liver disease as well as conditions associated with increased RBC destruction. Next to urobilinogen is a test for nitrite. So this test can identify many urinary tract infections, also known as the UTIs. So the next one is the leukocyte esterase. So leukocytes, also known as the white blood cells, um, if these leukocytes are present in large numbers, usually indicates a urinary tract infection or UTI. So it means that there is an inflammation somewhere in the urinary tract or the kidney. And the last substance to be tested is for the specific gravity. So this type of test, the specific gravity is actually a physical characteristic of urine. So it is a measure of the urine concentration. So however, this physical characteristic can be determined using a chemical test. So this test simply indicates how concentrated the urine is. So diba, those are among the 10 substances that can be tested through the chemical examination. So those kinds of tests, the one mentioned before, provide highly valuable information about the health of a person. So it is very helpful in the diagnosis of the patient. So the second major importance of the of chemical examination of urine is that the presence or absence of those constituents mentioned earlier in the urine provides information on the status of um, carbohydrate metabolism, kidney and liver function, and acid-base balance of the patient. So it was already mentioned before and explained. So those tests, such as the pH, it helps to determine the acid-base balance of a patient. And the last major importance of the chemical examination of urine is that the chemical examination is done to test for the presence of the undetectable substances which can't be observed by a mere physical examination nor the microscopic analysis of the specimen. So there are categories of chemical examination of urine. These are called the routine chemical examination and the special chemical examination of urine. So katong mga previously mentioned nga mga substances, kani sila, kani, and kani. These substances is unique to the chemical examination. So these tests are important because they can detect the substances that cannot be detected by the other two types of examination. Okay, so I believe that ends my report. So those are the three major importance of chemical examination. So in the meantime, please watch the short clip of the chemical examination procedure. So after this, so it is also for the summarization of the chemical examination of urine. So thank you for listening and God bless. Bye.